Well, the short of it is that, you know, patients who have sexual issues usually have a very complex set of issues that involve a number of aspects, psychological as well as physical. And the interesting thing is that because of the way in which cannabis works, it's actually very effective in treating sort of all of those different issues. Never would suggest that we should do this in the absence of addressing psychology through therapy and stuff like that. But again, cannabis is a great medicine to use in conjunction with other more conventional treatments like cognitive behavioral therapy, particularly for sexuality. I think one of the take-home messages that we need to focus on is that for women, less is more, but they tolerate higher doses better than men. And men with higher doses, you can actually have the whole deck of the whole house of cards kind of fall down and actually impede sexuality. But at very low doses, you know, you can sort of, you know, like 5 to 10 milligrams of inhaled THC component. You know, what we see is increases in arousal and erection and orgasm, as well as the satisfaction. I tend to recommend to people that they start with a strain that's roughly around 15% of the THC component. And there are a couple reasons I recommend that. One has to do with maximizing the entourage effect, and the other is in maximizing the ability to hone in on a minimum dose, whereas if you're starting at 35% THC, it's very hard to kind of find the right level in there. And then you start with a vaporizer and you start at a low amount, which is sort of, you know, 2 puffs, you know, 2 deep inhalations or hits. You gotta inform people, remind people to, you know, wait a few minutes between taking more puffs. Otherwise, it's very easy to kind of blast right through 2 and end up at 6, and that may actually be off-putting, and particularly in the sexuality context.